मैम व्हाट इज पीसीओएस? पीसीओएस क्या है?
Actually, what happens in PCOS that the eggs are produced in the ovary, but they are not released in our body. It so happens that in a normal female, every month one ovary produces an egg. Say in the month of Jan, right ovary is producing an egg, then next month left ovary produces eggs. That way, every month alternately ovary produces eggs. What happens in PCOS? The eggs are formed in the ovaries, but they are not released into the body. So what happens then? So these eggs, they form small cysts in the ovary, thereby giving the name of PCOS, polycystic ovarian disease or polycystic ovarian syndrome. So this is how this name is got when multiple small cysts are formed in the ovary, which are nothing but the unreleased eggs in the ovaries, which form small cysts. It is something like ultrasound, may we say it is like a pearl string appearance in the ovary. So a typical appearance, multiple eggs, multiple cysts are seen in the ovaries, which are nothing but the unreleased eggs which are formed by the ovaries but are not released into our system. So this is how we got the name PCOS.
मैम व्हाट आर अर्ली साइंस एंड सिम्टम्स ऑफ पीसीओएस? पीसीओएस के अर्ली साइंस और सिम्टम्स क्या हो सकते हैं?
Beta, there are many signs of PCOS. We cannot say early kya hai or late kya hai, but most important sign and symptom of PCOS is irregular periods, which is very common, which we see in majority of the patients. They'll come to us, they'll say that we don't menstruate for say 2 months, 3 months, 4 months, and then we get periods which can last for 3 days to up to 15-20 days. So foremost symptom, most common symptom is irregular periods in the ovary in the patient. They come at any time, and they can last after 4 or 5 months, they can last for a month or they stop in 2 to 3 days. Second common symptom that we see in PCOS is hirsutism. That is, in the female, there is male pattern distribution of hair. Now, what do we mean by that? That means upper lip growth is there, beard type growth is there on the chin, the side angles start growing, hairlines start receding, there is hair formation on the extensor surfaces of the arms and the legs, on the abdomen and the chest, at the back. So this is again, which is cosmetically, a female gets very perturbed. Why I'm having like every week, many a times every week, a lady has to go to the salon for her threading. Third common symptom that we see of PCOS is acne. It is not those acne which comes premenstrual and goes after the menses, menstrual flow starts. This type of acne is that they are persistent, big acne on the face, and the female gets really perturbed by these acne. So they are not only seen on the face, they can be seen at the back also. At the back also small acne are seen. Another common symptom is pigmentation, especially at the nape of the neck, which we call acanthosis nigricans. The nape of the neck, that is at the back of the neck, it becomes typically very dark, pigmented, coarse. The skin becomes coarse and rough. So many times patient has no symptom, but by just looking at the nape of the neck, we diagnose that this is a case of PCOD. Another common symptom of PCOD, very common symptom of PCOD is infertility. As the eggs are formed, but they are not released into the system. So if the lady gets married, she is not able to conceive. So very important system, and she comes to us, कि doctor मेरे periods तो ठीक है, महीने, 1.5 महीने, 2 महीने में आते थे, but now that I'm trying to conceive, I'm not able to conceive. And when we investigate, we find out that she's a typical case of PCOS, where the eggs are not being released into the system. Her AMH values are very high, they are more than 6.5. So this all confirms that she's a case of PCOD. We have to first treat PCOD, first treat that before we can make her pregnant. So these are the obesities and other symptoms, it is all due to hormonal imbalance. A female becomes obese, the more obese she becomes, the more a hormonal imbalance, more irregular periods, more hirsutism, more acne. So a sort of vicious cycle is formed in the case in these patients.
मैम, इज सर्जरी इज एन ऑप्शन फॉर पीसीओएस? क्या सर्जरी एक ऑप्शन हो सकता है पीसीओएस के लिए?
Surgery is only considered when the patient comes to us for infertility treatment. See, she's already say 32, 33, 34 years of age. She's in her mid 30s or in her late 30s, and we have diagnosed her with PCOD. Then we don't have that much time to treat her by medications, because medications may take 1.5, 2 years. So in that case, we go for laparoscopic ovarian drilling. The surgery that we do is by lap. We put a laparoscope inside by a 5 mm incision on the navel. We put a laparoscope inside. 2 5 mm incisions are given on the lateral wall on the left side, and we do ovarian drilling. What is ovarian drilling? We drill pierce each and every follicle, that cyst. By piercing each and every cyst manually, the ovary size is reduced. And eventually, after 2 to 3 months of rest, these ovaries start ovulating, and the ova is released into the system. But this surgery as an option is only done when the patient comes to us with infertility and she's in a hurry to get pregnant. Only in that case, we consider ovarian drilling.
Ma'am, do women need an ultrasound to be diagnosed with PCOS? क्या औरतों को
No.
अल्ट्रासाउंड की जरूरत होती है PCOS के डायग्नोसिस?
Ultrasound is not okay, it is one of the backbone of the diagnostic criteria, but it is not the only diagnostic criteria. Ultrasound will tell me polycystic ovaries or the pearl sting appearance of the ovaries, but many a times ultrasound is absolutely normal. Ovary size is normal, everything is normal, but patient has all the symptoms of PCOD. She has irregular period, she has hirsutism, she is obese, she has acne, she is infertile, but ultrasound is not telling me that she is a case of PCOS. The most confirmatory diagnosis is the hormonal evaluation, which is done on day 2 of the periods. So on day 2 of the periods, we do the female hormones LH, FSH levels. And if these levels, there is reversed ratio. By reversed ratio, I mean on day 2, the follicle stimulating hormone FSH should be twice the luteinizing hormone LH. But if this ratio is reversed, LH is twice the FSH, that means that is a confirmatory diagnosis of PCOD. So many a times, along with ultrasound, we do this lab test. We go for serum testosterone levels. We do DHEAS level. There is a battery of tests which are done on day 2 of the cycle to confirm PCOD. Ultrasound is one of the diagnostic method for diagnosing PCOD, but it is not the ultimate or the only one.
Ma'am, women will know for sure if they have PCOS. Is it so? औरतों को हमेशा पता ही होगा कि उन्हें PCOS है. क्या ऐसा जरूरी है?
No. No, Apurva, it is not a must that a woman will know that she has PCOS. Maybe she has no symptoms and she just comes to us for infertility checkup, and then we diagnose she has PCOS. Because even in PCOS, patients can have regular periods. Their periods can be normal. Their periods can be regular. They may not have any acne. They may not have any hirsutism, but they still have PCOS. It is not necessary for a female to be obese to have PCOS. Even lean patients can have PCOS, which we call lean PCOS. So anyone can have PCOS without them realizing that it is a case of PCOS, unless they come to us for some other thing and we diagnose that, yes, she is suffering from PCOS.
Ma'am, every woman with PCOS should go on the birth control pills. Is it so? क्या हर औरत जिसे PCOS है उसे बर्थ कंट्रोल पिल्स के लिए जाना चाहिए? ऐसा है?
बर्थ कंट्रोल पिल्स के लिए हम उसी में डालते हैं जिनके पीरियड्स इरेगुलर है, मतलब जिनको साइकिल 3-3, 4-4, 5-5 महीने में आ रहा है, उनके लिए पिल्स ट्रीटमेंट इज अ ट्रीटमेंट ऑफ चॉइस, बट नॉट ऑल द वुमेन. Again, if you have hirsutism, then we put them on those OCPs in which the progesterone component of the OCP is anti-testosterone. मतलब जो उसमें a birth control pill or the oral contraceptive pills have both estrogen and progesterone. It is a progesterone component which can be anti-testosterone. There are different types of progesterone. One of them, the 4th generation progesterone that we use is anti-testosterone. तो अगर आपको hirsutism है पर आपके periods regular हैं, then also we put you on OCPs, because the progesterone in that OCP is anti-testosterone. It will take care of your hirsutism. So it depends. See, every case is different. Every patient is individual patient. We individualize every patient before we start on the treatment. आंखें बंद करके कभी treatment नहीं start होती है. पेशेंट के क्या सिम्टम्स हैं, उसकी प्रायोरिटी क्या है, उसको बच्चा चाहिए, उसको अपने पीरियड्स रेगुलर करने हैं, उसको हार्सिटिज्म ठीक करना है. डिपेंडिंग अपॉन व्हाट पेशेंट नीड्स, व्हाट इज अ प्रायोरिटी, द ट्रीटमेंट इज इंडिविजुअलाइज्ड एंड स्टार्टेड.